When you say medicine is poison, I understand you are thinking of iatrogenesis. I googled this and it means death by medicine.
Yes, it originally meant brought forth by healer and could be good or bad. But since the time of Hippocrates, it is recognized as being damage caused by healthcare professionals.
Well, tell me more. But first, where do you get this information from? Because some of the numbers you mentioned earlier sound rather extreme.
Yes, of course. In 2003, 3 medical doctors and 2 PhDs published their review and close reading of medical peer-review journals and government health statistics. This study was led by Gary Null, PhD, who is an expert in health and nutrition sciences.
Okay. Research of research sounds like a valuable thing to do.
Yes. Here are the annual numbers of deaths in the U.S. attributable to medical care. Remember, these are not the people who die from their illnesses or injuries. These are people who die specifically because of what happened while they were being cared for. Adverse drug reactions while in hospital. These caused 106,000 deaths per year. This amounts to 290 deaths per day. Medical errors. These tragically caused 98,000 deaths. These are 98,000 people, plus their families and friends that are affected. The impact is enormous. Bed sores. 115,000 deaths. This one blows my mind. I had no idea bed sores could cause death. This is 315 people per day. Infection. 88,000 deaths. Malnutrition. 108,000 deaths. I believe this number includes many people in nursing homes. Outpatient adverse drug reactions. 199,000 deaths. Unnecessary procedures. 37,136 deaths. Surgery-related. 32,000 deaths. Those are the numbers.
Whoa. You have got to be kidding. That is horrific.
Damn right it is. It all adds up to 783,936 deaths. And by the way, the costs associated with these deaths is $282 billion every year in the USA.
Unbelievable.
If we used an even higher medical and drug error death rate from a 1997 study by Dr. Lucien Lepp, it would add 216,000 deaths to this number for a total of almost 1 million deaths per year.
This is dreadful. On a related matter, I have heard about unnecessary medical care. Do you know about this? And what about people who benefit from the medical system?
To answer your first question, there are 8.9 million people affected by unnecessary hospitalization and 7.5 million people affected by unnecessary procedures each year in the USA. Your second question about who benefits from the medical system is a great question. I will have to look into that. I suspect the numbers will be encouraging for the great work done, for example, in ERs for acute care needed by so many after an accident, or for the first 24 hours after a heart attack, or a stroke. But I am not hopeful for how well this system works for chronic illnesses like cancer, diabetes, and cardiovascular disease. But to answer your second question, who benefits from the medical system, from a different perspective? The answer has to be the heads and stockholders of hospitals, drug companies and food companies. Followed all too closely by supporters such as the media who are paid enormous sums for advertising. U.S. drug makers spend 2.5 times as much on marketing and administration as they do on research. In 2004, they spent $33.5 billion on promotion.
Point taken. In 2001, the heart disease annual death rate was almost 700,000 and the cancer annual death rate was just over 550,000. Even the lower estimate of almost 784,000 deaths makes the American medical system the leading cause of death in the United States.
For more information and to read findings of this study, anyone can Google "death by medicine" and Gary Null, spelled Null, or see the links below this video.
Thank you.